Welcome to the Dental OSCE Podcast. Podcast description. In this episode of the Dental OSCE Podcast, we dive into the management of dry socket. Thank you for tuning into this podcast, where we simulate clinical scenarios to help you refine your communication and decision-making skills. In this episode, we'll focus on the management of an oroantral fistula, providing practical insights into history-taking, patient education, and care planning. Let's dive into the case. Management of dry socket, alveolar osteitis. UK Guidelines. Step 1. Initial preparation. Greet the patient calmly and professionally to help reduce anxiety. Confirm the patient's identity and obtain permission to discuss their condition. Step 2. Quick history taking. Ask the following questions clearly and concisely. Can you describe the pain? Is it severe, radiating, and not relieved by painkillers? When did the pain start? Has it been 2 to 4 days since the tooth was extracted? Have you noticed a bad taste or smell in your mouth? Review the patient's medical history. Did you have a recent dental extraction? Do you smoke or use tobacco? Are you taking any medications, such as anticoagulants or bisphosphonates? Ask if the patient is taking any painkillers and whether they have been effective. Is there any use of contraceptives if it is a female patient? Step 3. Consent. Explain the diagnosis with empathy. You likely have a condition called dry socket. This happens when the blood clot protecting the extraction site is lost. Don't use jargons. Then you outline the treatment plan. I will clean the area, place a special dressing, and provide instructions for relief. Explain any risks or discomfort during the procedure. You may feel some discomfort, but we will make it as pain-free as possible. Obtain verbal consent to proceed. Step 4. Clinical examination. Say, I will now carefully examine the site. Look for the following. Is there exposed bone in the socket? Is there any food debris or inflamed tissue? Avoid using sharp instruments to prevent further trauma. Step 5. Pain management and local anesthesia. Say, to help with your discomfort, I will provide anesthesia. Apply a topical local anesthetic gel, e.g. lidocaine, for quick relief. If required, administer infiltration anesthesia around the socket using lidocaine with adrenaline. Confirm the area is numb before continuing. Step 6. Debridement and cleaning. Say, I will now clean the socket to remove any debris. Gently irrigate the socket using warm saline or a chlorhexidine solution. Use a blunt instrument to carefully remove necrotic tissue if necessary. Reassure the patient throughout. You may feel some pressure, but this will help with healing. Step 7. Placement of alvogel. Say, I am now placing a medicated dressing to relieve your pain and promote healing. Dry the socket using gauze. Take a small piece of alvogel and gently place it into the socket. Avoid overpacking to prevent pressure on the surrounding tissues. Step 8. Post-treatment instructions. Provide clear aftercare advice. Avoid rinsing or spitting forcefully for the next 24 hours. Do not smoke or drink alcohol, as this can delay healing. Stick to soft foods and drink plenty of fluids. Continue taking your painkillers as prescribed. Step 9. Follow-up. Say, I would like to see you again in 48 hours to check your progress and possibly replace the dressing. Advise the patient. If your pain worsens or doesn't improve, please contact us immediately. Educate the patient on preventing future occurrences, maintaining oral hygiene, and avoiding smoking can reduce the risk of dry socket. Step 10. Closing summary. Reassure the patient. Dry socket is a temporary condition, and you should feel better within a week. Provide emergency contact details. Ask the patient if they have any questions or need clarification about the instructions. Do you feel comfortable with the plan we've discussed? Closing summary. Thank you for listening to this episode of the Dental OSCE Podcast. In this session, we covered the essential steps, including taking a focused history, explaining the condition to the patient, and help managing dry socket, and also providing post-operative care instructions. Remember to prioritize clear communication, patient empathy, and structured follow-up care. Stay tuned for more guides to help you excel in clinical practice. Thank you, and take care. God bless you.